Howdy, Aaron Boster here with the Ohio Health MS Center, spending a few minutes talking about a topic which is all too often overlooked, sexual dysfunction. If hearing about sexual dysfunction or hearing about vibrators bothers you, please turn off this video. If you're still listening, thank you. Many people with MS can develop difficulties with sexual function. For men, whether that be arousal, obtaining an erection, maintaining an erection, ejaculating, or for women, whether that be sexual arousal, lubrication, and orgasm. These can become problematic for some MS patients, which is obviously a big factor in quality of life. So I think it's, number one, important that we recognize that this can happen. And I think that we have to normalize talking about it. I think that people with MS should be able to talk to their clinician openly, and that clinician should respond in kind so that as a team they can solve problems like sexual dysfunction. So I'm going to share a tip that I was taught, I think originally by a great MS neurologist, Elliot Froman. And it's called the vibrator trick, and it works really, really well. So let me explain what I'm talking about. Many people with MS develop sexual dysfunction because of damage to their spinal cord. So when the down theres get stimulated, all the information has to go up the spinal cord to the brain. And if there's lesions along the spinal cord, sometimes it gets interfered with and the message doesn't get there. So this is analogous to talking to someone across a room. If you're in a room with one other person and it's quiet, you can use an indoor voice and they can hear you. But if you then put 50 people in that room, suddenly you're screaming, you're talking really loud because there's all this interference for your voice to be heard. In a similar fashion, sometimes the amount of stimulation down there isn't adequate to overcome all the interference getting up to the brain. And so the vibrator trick can help with this. Step one, obtain a water-based lubricant, which simply increases the skin sensitivity. Step two, buy a plug-in-the-wall vibrator. And this is important. It can't be some double-D battery thing. We need serious firepower. And so you want to get a plug-in-the-wall vibrator. And then you want to apply it where it feels good. And you should try this on your own, before sex, during intercourse. I'll share with you that for both men and women with MS who have tried this out from my clinics, many come back with a thumbs up and tell me that it really assisted with obtaining, maintaining an erection, ejaculation, adequate lubrication, orgasm, things that are really important to adults. So, Aaron Boster with the Ohio Health MS Center sharing a tip on improving sexual function, the vibrator trick. Try it out. Take care. Bye-bye.